For week 5, our topic is all about first aid for sports injuries. Sports injuries refer to the kinds of injury that occur during sports or exercise. The term is commonly used to refer to injuries of the musculoskeletal system. Some types of sports injuries that officiating officials and athletes may encounter during the games are the following. Sprain. A sprain is caused by thorn fibers in a ligament, or a tissue that connects bone to bone. Swelling and bruising are some signs and symptoms. The following are the types of sprain: thumb sprain, knee sprain, and ankle sprain. First aid. Apply the RICE method. R stand for rest. Rest the injured part for about 24 to 48 hours after the injury. I stand for ice. Apply an ice pack or cold compress for 10 to 15 minutes as soon as possible after the injury. Repeat it every 3 to 4 hours and do it 4 times a day for the next 2 to 3 days. C is for compression. Compression reduces swelling. You could use elastic bandage for at least 2 days. E is for elevation. Elevate the injured area whenever you are sitting or lying down. Do not apply heat during the first 2 days as will only increase swelling. After 48 hours, start moving the limb gently but only enough not to cause pain, and gradually increase the range of movement. Let pain be your guide. Next is strain. A strain is a twist, pull, or tear of a muscle or tendon, a cord of tissue connecting to muscles to the bones. A muscle strain or pulled muscle occur when your muscle is overstretched or torn. This usually occurs because of fatigue, overuse, and improper use of muscles. First aid. Apply ice right away to reduce swelling. Wrap the ice in cloth and do not place ice directly on the skin. Apply ice for 10 to 15 minutes every 1 hour for the first day and every 3 to 4 hours after that. Fracture. A fracture is a break in a bone that can occur from either a quick, one-time injury to the bone or from repeated stress to the bone over time. The following are the characteristics of bone fracture. We have transverse, linear, oblique, spiral, green stick, and comminuted. First aid. Apply the RICE method. Keep the limb in the position you found it and place soft padding around the broken bones. Don't move the broken bones. Splint must be long enough to extend beyond joints above and below the fracture. If there is an open fracture, cover it with a clean gauze pad. Apply pressure to control the bleeding. And don't try to push the bone back into the wound and don't attempt to clean it. Get medical attention immediately. Fractures of the femur and pelvis may cause severe internal bleeding. Heat exhaustion. Heat exhaustion is the response to heat characterized by fatigue, weakness, and collapse due to inadequate intake of water to compensate for the loss of fluids during sweating. First aid. Have the victim lie down with his or her feet elevated. Keep the victim cool. Give him or her electrolyte beverages to sip or make a salted drink. Monitor the victim for signs of shock. If the victim starts having seizures, protect him or her from injury. If the victim loses consciousness, give first aid for unconsciousness. Dislocation. When two connected bones are separated, the joint is described as dislocated. Contact sports such as football, basketball, and lacrosse, as well as high-impact sports that can result in excessive stretching or falling, cause the majority of dislocations. Types of dislocation: shoulder dislocation, wrist dislocation, hip dislocation, knee dislocation, and ankle dislocation. Before the medical care arrives, leave the joint alone. Attempting to move or jam a dislocated bone back in can damage blood vessels, muscles, ligaments, and nerves. Put an ice pack covered in a cloth on the area around the joint. Ice can ease swelling and pain in and around the joint. Muscle cramps. A muscle cramp is a sudden and involuntary contraction of one or more of your muscles, mostly in the leg muscles, particularly in the calf. Beside the sudden, sharp pain, you might also feel or see a hard lump of muscle tissue beneath your skin. First aid, stretch and massage. Lengthening the cramping muscle using a gentle, sustained stretch, then lightly massage the area until the cramp subsides. In cases of severe cramp, an ice pack applied for a few minutes may help the muscle relax. Some medication can be helpful to control muscle cramps. See your doctor for further information. For further treatment, see your doctor if you experience regular muscle cramping or if cramps last longer than a few minutes. Knee injuries. Knee injuries can result from a blow or twist to the knee, from improper landing after a jump, or from running too hard, too much, or without a proper warm-up. The following are the most common knee injuries, from minor to major. We have tendinitis. A tendinitis is a condition where the connective tissues between your muscles and bones become inflamed, while the patella is a triangular bone at the front of the knee. Several tendons and ligaments connect to the kneecap, including ones attached to the upper leg and lower leg. Femoral compression syndrome is when you can't move or feel part of your leg because of damaged nerves, specifically the femoral nerve. This can result from an injury, prolonged pressure on the nerve, or damage from the disease. In most cases, this condition will go away without treatment. While iliotibial band syndrome, or ITBS, is a common knee injury that usually presents with pain and or tenderness on palpation of the lateral aspect of the knee. Bursitis is a painful condition that affects the small, fluid-filled sac called bursae that cushions the bones, tendons, and muscles near your joints. Bursitis occurs when bursae become inflamed, and the most common locations are in the shoulder, elbow, and hip, and often occur near joints that perform frequent repetitive motion. The anterior cruciate ligament is one of the key ligaments that helps stabilize your knee joint. The ACL connects your thigh bone to your shin bones. It's most commonly torn during sports that involve sudden stops and changes in direction, such as basketball, soccer, tennis, and volleyball, while the posterior cruciate ligament is a ligament within the knee, connects the thigh bone to your shin bone. Although it is larger and stronger than the ACL, the posterior cruciate ligament can be torn. PCL, or the posterior cruciate ligament injuries, are often due to a blow to the knee while it's bent. If you collide with another player when you're playing a sport and the side of your knee is hit hard, your MCL may be injured. The MCL, or the medial collateral ligament, is a band of tissue that runs along the inner edge of your knee. It helps to connect your shin and thigh bones to keep your knee stable and working properly when you move. When your MCL is damaged, your knee can be overextend itself or bend too far in a direction that it's not supposed to bend. You may heal on your own with basic care, rest, and rehab, but if your injury is severe, you may need to have surgery. The lateral collateral ligament is a thin band of tissue running along the outside of the knee. Like the medial collateral ligament, the lateral collateral ligament's main function is to keep the knee stable. What causes a tear of the lateral collateral ligament? Most often occur from the direct blow to the inside of the knee. This can stretch the ligaments on the outside of the knee too far and may cause them to tear. This type of injury occurs in sports that require a lot of quick stops and turns, such as soccer, basketball, and skiing, or ones where there are violent collisions such as football and hockey. First aid. Stop your activity immediately. Don't work through the pain. Rest the joint at first. Reduce pain, swelling, and internal bleeding with ice packs applied for 15 minutes every couple of hours. Bandage the knee firmly and extend the wrapping down the lower leg. Elevate the injured leg. Don't apply heat to the joint. Avoid alcohol, and this encourages bleeding and swelling. Don't massage the joint, as this encourages bleeding and swelling. And that's it for our topic for today. I hope you learned to appreciate the significance of basic first aid in common sports injuries, especially during the COVID-19 pandemic. I'll see you again in the second part of this video. Goodbye and God bless.